Yeah, for many, many years we are lacking of effective drugs to deal with obesity. Obesity is the new pandemic is affecting worldwide a lot of people, mainly the poor people of the rich countries. And we've been using different ways to treat obesity. The most effective way is still the surgery. The gastric bypass and the sleeve are reducing numbers of obese people, and it's effective treatment in 80% of the patients. However, we were always looking for the magic drug to make the people thinner, and Ozempic is giving us part of this effect. We know these kind of drugs, GLP-1 agonists, for many years. We've been using for diabetes, and we know from the beginning that these drugs induce a bit of weight loss. However, the companies, the pharmaceutical companies, develop the new version of this GLP-1 agonist, which is semaglutide, which is the most effective one we have. And we know the last study was done a year ago, randomized control trial, very famous in New England Journal of Medicine, and raised this weight loss, which is much more in the patients having the drug against the ones who were only controlled. However, I have to say that it's not only the drug. In the study, it was as well the exercise and the lifestyle modifications, which are essential when you are taking this drug. This drug is not making the job by itself. You need to make your changes. This is a help that makes you have more or less hunger and make the change you need to lose weight.
So once you have this drug, what do you need to do to make it work properly? And when you finish having the drug, what happens? Do you gain the weight straight away, or?
Yeah, that's a good question. That as everything happens with short-term treatments in obesity, which are not the surgery, and even with some cases after the surgery, is the weight regain after the treatment. And this is happening because the patient hasn't established an adequate lifestyle modification. And the drug is helping you to establish this lifestyle modification, which will stand forever. The diet is not, I'm doing a diet 1 week and that's all. No, obesity is a chronic disease. You have to take this into account. You are diabetic, you know you cannot eat sugar. If you are obese, you have to know you can eat very, very little, because otherwise your body is going to increase again. So you need to exercise daily. You need to have a balanced diet, avoiding certain kind of food like very fatty foods or very high sugary foods and sugary drinks, and making this your routine in your lifestyle. The drug is going to help you to do that, but it's, as soon as you leave the drug, you have to maintain the weight with your diet and your lifestyle modification.
Mm-hmm. Now let's talk about some of the side effects. We see common ones as like nausea, stomach pain, diarrhea, constipation, but there have been articles about more concerning side effects. Some people being hospitalized, other reports of paralysis or some form of depression. Those are being looked into at the moment. What can you tell us about these more concerning side effects?
Yeah, we are at a very early stage, so it's difficult to say until we have more patients, but it is a very worldwide used drug, so these things are going to appear, and we need to find out if these are really related to the drug or not. In my experience, most of my patients are having nausea, are having very scarcely vomiting. 1 or 2% of the patients having vomiting. Some of them as well, 2-3%, are having severe diarrhea, watery diarrhea, and we need to stop the treatment. Is very unlikely, but can happen. And another 2 side effects which are very common are constipation and like asthenia, which is a sensation that you feel that you are slightly tired, you have no feel to do anything. But most of the times are very, very mild side effects.
When it comes to these more alarming ones, the ones like paralysis, depression, some of the ones that are still being looked into, can you help us understand, are those side effects that have only come out now when it's being used for weight loss, or were these already an issue when it was being used for diabetes?
I haven't heard about these effects previously. Not sure about the new ones that are related with the drug. Even is reported suicidal thoughts with this drug. and it's difficult to know exactly if they are related to the drug, because some of these patients are really addict to the food, and then if you're an addict, you're taking over his addiction. Sometimes these suicidal thoughts are more related with the lack of discomfort, eating or comfort they are obtaining from the food than itself by the drug. But we don't know yet, so it's too soon.
Okay. How do you feel about using this drug on people at the GHA, which you are doing, without fully knowing all of these things? Because I suppose more will come out, no, as it gets used more openly.
Yeah, well, like any other drug, if you read the prospect, you cannot take anything. Everything is causing a lot of things. The interesting thing is when these drugs are approved, this has been tested in a very strict way. So just to decrease the number of these cases and severe side effects. So when they are in the market, that means they are safe. As soon as we start to use in the market, we need to recheck and to recheck every day, because the studies are done in a small amount of patients. Now we are treating millions of patients with the drug, so we will find out more very unlikely effects, but because the population is bigger, we will find more effects. Patients are quite well informed now. They are coming to the clinic, they are watch videos, they have read on the internet, they read the Ozempic website, all the info, and we are checking. The most concerning thing is about patients with family history of cancer, thyroid cancer, or pancreatic cancer, or even a strange disease called multiple endocrine neoplasia, which you should avoid this drug in these kind of patients, because can cause the increased incidence of these tumors.
Can you just remind us of the criteria for patients here at the GHA if you are going to prescribe Ozempic to them?
Yeah, because it's a bariatric drug, we are using the same criteria as for any other bariatric treatment, which is the surgery at the GHA. So patients should be BMI above 35 with some comorbidities like diabetes, hypertension, arthritis, sleep apnea, or BMI above 40 without these comorbidities. They have to attempt a serious attempt of weight loss monitored by our dietitian, and if this serious attempt fail, then we try with the drug to give them the chance to lose the weight. We are using as well the drug with a small amount of patients where the surgery has failed, and this drug is particularly effective in the patients who had already a gastric bypass, which is a huge amount, a huge source of GLP-1 when we do the surgery. The GLP-1 is produced by the pancreas as soon as we change the route of the bowel. And when this surgery is failing, which is happening in 20% of the patients, we are using this drug with very good effects. So these patients who had already the surgery and under us in the GHA, they can come to the clinic and we can consider this treatment for them as well.
How many people are on Ozempic for the purpose of weight loss through the GHA at the moment?
Don't have exactly idea. Should be around 100 patients.
Mm-hmm.
Yeah.
And of those patients, do you have any stories you can share with us? Has it been very successful? Any details you could give us?
Yes, any other thing in biology, we have this Gauss distribution, which is a normal distribution, which is like a bell. We have very good responders on one side, less than 3%, which are amazing. They can lose 40 kilos if they are extremely obese. And we have the other side of the curve, which are non-responders at all, which are less than 3-5%. And in the middle are most of the patients. So we are expecting weight loss, which is the best weight loss achieved with a drug. Around, depends on your weight, but between 10 kilograms and 30, depends on your basal weight.
Wow, so very substantial. Now, of course, everyone is seeing the supply issues when it comes to Ozempic. It was originally used for diabetes, and there is a concern that diabetics might not be able to access this medication because so many people want the magic drug, as you mentioned. So what measures does the GHA have in place to to deal with the supply issues?
It seems there is a worldwide shortage of this drug because it's going crazy after all these famous people coming out in the social media injecting the drug, but it's becoming very popular. Even Boris Johnson wrote an article recently about the benefits of Ozempic. I cannot say anything because I'm a surgeon, I'm not a pharmacist. As far as I know, the supply in Gibraltar is being on and off for many weeks. Sometimes we have, sometimes we don't. The Spanish agency for the drugs, Agencia Española del Medicamento, is telling me there is Spain, there is no shortage of 0.5 and there is a small shortage of 1 milligram presentation, which is going to be sorted now in August. And this is all the info I have about supplies. And I would like to have more, but.
So does the information you do have on supply influence, how many people you prescribe this to, or do you just continue to prescribe despite the ongoing supply issue?
How can I deal with this? This is a difficult question. I'm the prescriber. So I think that if the patient is coming for a drug and I can prescribe it, I'm prescribing. The other side of the business is the pharmacies and the pharmaceutical industry. Unless Novo Nordisk, which is the main company, tell us that there is no producing anymore and we cannot prescribe, how can I deal with the shortage?
Is there any risk to the patient if they begin the treatment for Ozempic and then because of supply issues they're not able to continue?
Yeah, it's always the risk of relapsing. That depends on how long have you been in treatment. You can stay a couple of weeks, even 3 weeks without the treatment and maintain the effects of the drug. So there is no an urgency to get the drug if you have 1 week you don't have the Ozempic. But there's always the risk, as any other temporary treatment for obesity, of relapsing. Yeah? Mm-hmm.
Very quickly before we go, I know it's a long interview, but when we started, you had a big smile on your face when you started talking about the effects of Ozempic. How do you feel about this drug going forward? Does it give you, is it positive? Are you looking forward to what it could do for the GHA? Where do you see it going?
Well, as I told you, we are living in a pandemic. Gibraltar is not is one of the best examples of this obesity pandemic. Here we need to deal with obesity in such a different ways, but this is one thing. But the main thing is prevention. As any other thing in medicine, is prevention. So we are in a small place. We have all the tools to prevent obesity here. People need to exercise. People need to eat properly. It's better not to get fat, because when you gain weight, it's very difficult to lose. Well, everybody has experienced that. It's more easily because our body is designed to gain weight. It's not designed to lose it. So there is always physiological mechanisms to prevent the weight loss. That's the reason most of the diets are failing. Mm-hmm. So it's very important. It's very important, the prevention. It's very important from the schools, how to teach the kids how to eat properly, to avoid the junk food, to avoid the sugary drinks, to avoid the McDonaldization of the diet. Is happening everywhere, and we are importing the lifestyle from United States to the rest of the Western countries, and that's crazy.